natural capacity to expel it out. Cough is the very good sign in children, according to me. Because even though children who are suffering from cough, more than 10 to 12 days, also they are not reaching any school meetings, not upsetting anything. But after that, they're using some cough suppressants, immune suppressants, antibiotics. What happening? Due to the cough suppressants are not working properly, maybe histamine, leukin, interleukin, kinins. These are all natural suppressants, natural responses of immune system of the human respiratory tract. These are all very well managed natural response. After giving so many of other medications, they are losing their own natural activity. That's why what is happening, mucosal invasion. Actually what happening, there is a microbial agent landing into the respiratory tract. After mucosal invasion, it has to engulf and macrophage and throw it out through a expectoration. But not is possible in children with low vitality, low immune system, low upper respiratory tract development, and ciliary action of the upper respiratory tract is damaging gradually. Bacterial complications such as otitis media, acute sinusitis, and inflammatory sequels such as asthma. After what is happening, the chronic, untreated or not properly treated upper respiratory tract infection leading into asthma. Asthma is a acute exacerbation due to the narrowing of the bronchioles. The pathogenesis, recurrent respiratory tract infection is complex, involving anatomy and physiology of the respiratory system. When you call upper respiratory tract infection, I will call is recurrent respiratory tract infections, because the person coming regularly every month, every week, sometimes 2 months in a once, like that. Environment factors, impaired immunity. Here was the respiratory system, here was the focusing on the common conditions homeopathy physicians observe in the day and clinical practice, rhinitis, pharyngitis, tonsillitis. If you see 20 to 30 cases in a practice, if you see 10 persons, 10 children in your practice, there may be 10, maybe rhinitis, pharyngitis, tonsillitis. My aim and objective is to assess the benefits of homeopathic treatment with the upper respiratory tract infection, to assess the quality of life and children through visual analog scale in 2 levels. Review the history and physicians of patient with upper respiratory tract infection, outline the common obstacles in the homeopathy management of upper respiratory tract infections. Outline common obstacles. I found there is a common obstacle where we practice in a rural area. Vizianagaram is somewhat rural area of Andhra Pradesh. There are surrounding more than 50 to 60 minute villages, hamlets. These children not receiving proper food and nutrition, and even no sanitation areas. But these are overcoming the sanitation, but not overcoming the poor nutrition. Government and all institutions providing the nutrition, but not receiving this nutrition. Study is unicentric, means OPD, MAHS, our hospital, and my clinic also, for several cases. The cases are followed a minimum period of 6 months to 1 year. Some cases will found in 2 to 3 months also. After the follow-up, intensity of symptoms and assessment of the following grade through visual analog scale at 2 levels. Open label clinical observation, children to 2 to 12 years of age. Why? Because most of the kids are coming to OPD after taking so many of medications, after taking so many antibiotics, steroids, and all those things, after losing all the hopes in allopathic way or any other way, they are coming to the OPDs, doctors do something. Because my baby is not going to school, even though going to school, not concentrating, not getting good marks. When teacher is saying something, baby is rhinitis, if it is possible to listen, to concentrate on the what teacher is said. Interventions are appropriate, individualized homeopathy medicines in central potency, and the essential dietary measures include adequate daily intake of iron, vitamin D, and vitamin A through food. Inclusion criteria, 2 to 12 years of age, both genders, diagnosed cases of upper respiratory tract infections. Exclusion criteria, secondary causes of recurrent respiratory tract infection, maybe genetical, immune deficient, chronic, like that we excluded. Children who are undergo any other ongoing treatment with chronic heart disease, children who are undergoing any ongoing treatment with interface with the homeopathic treatment. Any other treatment also, children are advised to take homeopathic treatment because some of the patients not interested in taking complete homeopathy treatment, not relying on us. That's why we can advise that you can take both the treatments. This section provides the details of the case in the follow-up order: patient description, case history, physical examination results, results of pathological other investigation, treatment plan, expected outcomes of the treatment plans, actual outcome. The presenter should ensure all the relevant details are included and necessary and included. Clinical data of these case series obtained from the observations of the treatment of upper respiratory infection by taking about 15 cases. These are analyzed and interpreted with respect to given medicines. Treatment results are basing on the visual analog scale. They are represented in the form of statistical diagram. Actually, it is missing. Actually, we have taken around 300 cases. We found relief of the symptoms with all the cases, but small time. But we introduced some nutritional supplement and vitamins, minerals, and educated the children with these. After that, sometimes, initially we failed to failed recurrent respiratory infection, but after that, we called it as a upper respiratory infections because of these medicines, homeopathic treatment, plus nutritional supplements and educational to the parents. And given, we got good results, and among them we have taken only 15 cases. The observational study shows better outcome measured through VAS scale 2 levels, cough, severity, and sinonasal symptoms. These are the predominant symptoms: cough, severity, and sinonasal symptoms. One or other. If the patient is better by cough, he will be suffering with sinonasal symptom. If the patient is better by sinonasal symptom, followed by cough. Actually, cough is a good symptom according to us, but even though patient is not having any complaint of fever, appetite, and all this, simple cough. Had adequate daily intake of iron, vitamin D, vitamin A within the range of recommended compared to the other. 1 minute. With this clinical study, view of effectiveness of homeopathy remedies, elimination of maintaining factors, adjuvant therapy showed better results in RRI with clinical outcome which measured through VAS scale. So we like to recommend necessary supplement along with the individualistic medicines, and this may be due to the limited period of less number of cases. Further research need to be through more late. My point is, if you see any upper respiratory infection or recurrent respiratory infections, you must advise history taking. Please advise supplements, vitamins, deficiencies. It will be better outcome than regular students. Conclusion, thank you for giving a great opportunity. My management, principal, students, faculty, and all. Thank you, one and all.
Thank you, sir. May I call upon the second speaker? May I call upon the second speaker, Dr. Ritesh Ratnakar Shet.
A very good evening to the dignitaries and the delegates who are present over here. Today I'll be presenting a clinically rare case and a challenging case, a case of signet ring cell carcinoma of the rectum, which was managed integratively by using the standard oncological treatment and along with the individualized homeopathic treatment. Now, this case is a very significant case because it has shown marked changes in the histopathological report, and there is a regression in the size of the tumor. The introduction. The signet ring cell carcinoma represents rectal cancer which is less than 1% of the colorectal type cancers, and it is basically known for its rapid progression and the poor prognosis. Basically because of its nature of too much of rapid progression, and there is a mucin production is more in such condition. So patient usually present at a stage of T3 to T4 stage and with a nodal involvement, and in this condition there is typically less chemotherapy response seen in the patient. So integrative oncology, when combined with conventional cancer care with individualized homeopathy to improve the tolerance and the systemic vitality of the patient. Now, the objective of the study is to document the clinical improvement in the patient, the radiological improvement in the patient, and the histopathological improvement under integrative care. The case presentation, the patient named AB, 59 years old male who is a corporate professional from Mumbai, presented with the complaints of irregular bowel movements with flatulence, and there is a frequent urge to pass stools since last 2 months. The diagnostics which was done initially, the endoscopy which was done, which was normal, then the colonoscopy was done, where it showed signet ring cell carcinoma when the biopsy was obtained. Later on, MRI which was done on 9th of November 2024, which showed it as a T3N2 mesorectal fascia positive case. The PET scan which was done on 18th of November 2024 showed an hypermetabolic lesion with an SUV level of 6.7. Then started with the treatment of 6 cycles of chemotherapy plus radiotherapy was there during the time frame from December 24 to February 2025. The PET scan which was repeated in February 2025 showed reduction in the metabolic activity, that is the SUV dropped to 3.9 level, which showed a partial metabolic response to the treatment. Surgery was advised to the patient on 26th of June 2025, which was a laparoscopic abdominoperineal resection with end colostomy was done. And the histopathological report, when it was done on 18th of July 2025, there was a near complete regression in the size of tumors. That is, the tumor reduced from T3 to T1 with N0 no nodal involvement with a Ryan regression score of 1. Simultaneously, we have started the homeopathic management to the patient. So sequentially, the remedies which was alternated over here was sulfur 200 and carcinosin 200. In this homeopathic intervention, I have used the A.U. Ramakrishnan's method of cancer management, where the dosage is given to the patient over a period of 2 hours, 15 minutes. The divided doses is given. The procedure is 3 pills are being dissolved in 11 spoons of water, and every dose of 1 spoon is given to the patient every after 15 minutes over a period of 2 hours, 15 minutes. And the last dose, that is the 11th dose, is preserved, and the same dose is used next day, and addition to it, 10 more spoons of normal water is added, and the dose is again repeated. So the procedure is done for a period of 7 days of sulfur, followed by a specific remedy, that is carcinosin, which is given for the cancer. As the treatment progressed and the patient also started taking chemotherapy, patient came down with the symptoms of, that is the reactions of chemotherapy. So that was addressed by giving the specific remedies or the supportive remedies, that is Dux vomica was given. When the patient came with the complaints of chemo-related indigestion, there was nausea. Arnica was given post-surgical effect to control the soreness of the patient, that is the wounds. Aloes ocratina was given when there is a diarrhea with a mucus which was present. Cadmium sulf was given when the person complains of darkening of the skin and the effect of the chemotherapy. For mucosal recovery, the dosing method which was used was a plastering method, and water potentization was given. The adjunct nutrition was also advised to the patient, that is Dr. Williams Lee anti-angiogenic diet was given. That is, patient was advised to have fish, patient was advised to have nuts, patient was advised to have apples. Okay, these are the anti-angiogenic diet was advised. Now, coming to the response after the therapy, the scan, the PET scan which was repeated showed reduction in the metabolic activity. So the baseline PET scan when it was done, the lesion was 6.1 centimeters with a XUV max of 6.7. After the therapy, the lesion was 5.2 centimeters with the SUV reduced to 3.9. The histopathological report showed near complete response as an outcome, where the first histopath, when it was obtained, it was a T3N2 report with a mesorectal fascia positive condition. And after the treatment, that was like report when obtained post-surgery, the tumor regressed to size T1 with no nodal involvement with TRG score 1. The CA level before the treatment, it was 5.91, which has drastically reduced to 2, which is normal. So there is a reduction in the tumor marker. The weight of the patient, which was 52, significantly improved with integration with the homeopathic treatment. So there was an improvement in the nutrition and the strength of the patient. So along with the chemotherapy, the patient could do his regular daily activities. The quality of the life, the patient during the treatment was having a lot of lethargy, fatigue, there was loss of appetite, which was maintained with the homeopathy, and the patient was active during the treatment, and there was a good resilience to the treatment which was given. Coming to the discussion part, the integrative care correlated with improved tolerance to the therapy which was given to the patient. There was a good functional recovery, and the quality of the life of the patient was also good. So the hypothesis, there is an enhanced systemic vitality and symptom control, improved adherence, and the recovery was seen in the patient. So learning points from these cases: individualized homeopathy can enhance the resilience of the treatment. Early supportive care reduces the toxicity, so the patient was coming down with peeling of the skin, blackening of the skin, the nail was falling off, so that was managed with the homeopathic medicine. Even the platelet counts was also managed, even the LFTs which was elevated, those LFTs was also managed with the homeopathic treatment. So it requires interdisciplinary coordination from both the allopathic side and also the homeopathy. So the limitation of this study is, this is a single case, so I cannot prove the causality of it, but can warrant the further controlled trials, and it can become the hypothesis for further studies. So conclusion, the individualized homeopathy co-management integrated with standard oncology showed clinical and histopathological regression with improved quality of life, and this case highlights the potential of integrative, patient-centric oncological care. These are the references which are taken from PubMed and open access journals and PMC. I acknowledge the patient and the family for giving their consent. I also acknowledge the surgical and oncological team, that is Dr. Roy Patankar and Dr. Tanveer. I acknowledge Dr. Nicola Coutinho, the clinical mentor for me, and also my college, that is Sri Kamakshi Devi Homeopathic Medical College, for giving me this opportunity. And finally, I thank the scientific committee of EXPLORA 2025 for giving me the opportunity to present this case over here. Thank you for the patient listening.
Thank you, sir. We shall now move on to our final speaker, Dr. Minnie Ivy.
Good evening, everyone. I am going to present a research topic, a comparative study to assess the efficacy of different potencies of Abroma augusta in reducing blood glucose level, a Drosophila melanogaster diabetic model study. Myself, Dr. Minnie, professor in Department of Mathematics, Father Muller Homeopathic Medical College. This is a research done under Rajiv Gandhi University. I was a primary investigator, and also I had a co-investigator, Dr. Gino Jose. Introduction, diabetes mellitus, as we know, it is one of the important diseases. It is more prevalent in India. Also, a survey is conducted, and it is found like 12.1% is the prevalence, especially in Indian adult, we can see like 12.1% prevalence is now, it is running in India. Also, we know when diabetes comes, they will be taking oral glycemic synthetic drugs. And we know there are long-term treatment, they have to continue it. Also, it will be ending with some of the complications, like there will be GIT complication, hematological. Also, it will be affecting the organs like liver, kidney, like that. So homeopathy is one of the most widespread alternative system of medicine, which is based on law of similia. So here mainly, since diabetes is more common in India, we have started conducting one study with the Drosophila. You all know the Drosophila, commonly we know it as fruit flies. It serves as a valuable model organism in diabetic research for several reasons. So one important reason we have used Drosophila as because conservation of metabolic pathway, many metabolic pathways and regulatory mechanisms are highly conserved between fruit flies and human. That's why we have selected Drosophila as one of the important model for our diabetic study. So here, when you see the second reason, we can easily manipulate the genetic manipulations in fruit flies. Fruit flies have a relatively short life cycle and produce many offspring, making them ideal for genetic studies. So here, researchers can easily manipulate the fruit fly genome to create model of diabetes. So that's why we have used this mechanism. And here, mainly, we have used, if you see this slide, you can see female and male. Female Drosophila is quite big compared to the male. Males will be having 2 spots in the wings. So easily we could identify, we used to identify it through the microscope. So other important thing I would like to mention, like Abroma augusta. This is a commonly used medicine. Usually we use it in our homeopathic practice. And we know this is an important drug which belongs to the Malvaceae family. And also there are different alkaloids are present in this Abroma augusta. Also it contains some of the important alkaloids like flavonoids. And also there are glycosides are there which will be acting through the mechanism, and it will be relieving the diabetic cases. And mainly we have put the aims and objective. Like there are 2 aims and objective were there. One is to assess the effectiveness of homeopathic medicine reducing blood sugar. Second is a comparative, to compare the effectiveness of tincture and different potencies of Abroma augusta. Also, methodology, here we have selected, already I have mentioned, we have selected the Drosophila melanogaster model. Mainly this study, we have done it in the Yanapoya Research Center. First, we have identified the Drosophila, and we were maintaining it in the Drosophila neurogenic lab. And also, we were ensuring the important things like temperature. Usually it survives, it is having a 50 days of life cycle, it will be surviving in 25 degrees Celsius of temperature. So those things we were maintaining also with the humidity. And materials we have used, first is drug, also Drosophila we have used, drug we have used a tincture, along with that different potencies we have used. Also the feed which we were giving to the Drosophila, mainly it contained the cornmeal, yeast and agar. Also different equipments were needed, so fly vials, micropipette. Also, we have used carbon dioxide mainly to anesthetize the Drosophila. And mainly here research protocol which we have taken, one is research design. It was an experimental in vivo comparative study. Also considering the ethical consideration, Drosophila melanogaster is not subject to animal ethic regulation because it is an invertebrate model organism. So it is exempted from the animal ethical regulation. So it was little easy for us to get the study approved. Also, we have done the proper disposal of all the chemicals as according to the institutional ethical committee. And this study we have taken 1 year duration. Here mainly the blood glucose level of each group have assessed initially using the standard procedure and compared to the standard flies. And already I have mentioned it is having a 50 days of life cycle. We have divided the group into 5 groups. And we were observing the study, or we were observing in the lab for 10 days. So we made the group as A, B, C, P group and X group, because A was, we were giving the Abroma augusta tincture. B group, we were giving the 6C potency. 30C, we were giving into the C group. Also, we had a positive control. Along with that, we had a standard group. So this is a study which we have conducted. This is some of the photo of the things which we have taken during the study. And also, after 10 days, we have withdrawn the hemolymph, that is called as the body fluid of the Drosophila. And here mainly the assessment parameters we have used. One is hemolymph glucose level estimation. And after treatment, flies have homogenized in phosphate buffer, and we have supernatant things is collected after centrifugation, and also result is read in microgram of glucose equivalent per mg of protein. So here mainly, other than the glucose level, we have done survival assay also. For each group, control group, positive group, and different potencies, we have done the survival assay. Also, the statistical tool which we have used, one is paired t-test, second one is ANOVA. ANOVA we have used for comparing different groups. So we have applied a hypothesis, null hypothesis, where homeopathic medicine, Abroma augusta, is not effective. As an alternative hypothesis, it is effective. So these are the reading experimental data we got after doing the different group, 5 group. So you can see the reading here. All these are the glucose content, microgram glucose per mg protein. So here we have analyzed the experimental data. This is a summary. Also you can see the graph which we have put after analyzing the data. So here mainly 5 group we have maintained, tincture 30C, 6C. Also the positive we have used as agarbose. Also we had a comparison group. So here, after doing the statistical analysis, we could see the, after doing the paired t-test, the p-value, it was coming less than the 0.05. So here mainly the mother tincture was more effective compared to the other tinctures. So as a result, the experiment on Drosophila melanogaster demonstrated the efficacy of homeopathic mother tincture in reducing blood glucose level. Results indicated a significant decrease in glucose level among the treated group, suggesting the potential of homeopathic mother tincture in managing hyperglycemia. So as a discussion part, the use of flies in the research for scientific evidence put less weight on human subjects and also more control on the study in every aspect, and thus the scientificity of the study. So future research on more medicines and potencies will serve more beneficial to homeopathy as a system of scientific world in coming years. So as a conclusion, I would like to conclude the experiment on Drosophila melanogaster provides promising evidence that homeopathic mother tinctures can effectively reduce blood sugar level. So further studies are needed to validate these findings in more complex organisms and to explore the underlying mechanisms of action, which could contribute to the development of alternative approach in managing hyperglycemia. So the implication I would like to add as like the current scenario showing an alarming number of diabetic cases on the rise, especially in India. There are many more reasons for this, but a permanent cure is not yet available. The side effects and the negative implications of now available treatment makes the treatment less desirable. So this is where other system of medicine, especially homeopathy, comes into the play with medicine that are based on organic matter. So these are my references. Also, I would like to acknowledge our FMHMC, also the FMCI, who had given all the logistical support. Also, I would like to acknowledge the RGUHS, Rajiv Gandhi University, and our gratitude to the subject experts, especially Dr. Shyam Prasad sir. So thank you very much for your patience listening.
Thank you, ma'am. We now come to the end of this open forum. I kindly request Dr. Herald Roshan Pinto, moderator of the session, to share his insight about the presentations.
As MC has already expressed that we have come to an end of the session, so quickly I'll just give a feedback. First of all, I compliment all those people who have stayed back. Because of you, this session was possible. Even though in less member, maybe the discipline what you are following, keep it up, because this discipline will do good in your future. And we had 3 speakers today, and these 3 speakers have given a very good insight to the research topics. It is like after ending of the whole day session, putting a cherry on the dessert. So complimenting all 3 speakers. First, Dr. P. Suresh Kumar from Andhra Pradesh. He has presented a very common problem, which under the pediatric group. And he has a vast experience of 10 years, and especially the upper respiratory tract infection, where in pediatric group, 80 to 90% cases to your clinics of this age group, and along with these conditions. And sir has given one insight, because as per Hahnemann guidelines, in a chronic case, when case comes, Hahnemann gives a protocol of treatment. First he says not to give us medicine. First he says that find out whether it is if the chronic is miasmatic or non-miasmatic. And second important point, he says that find out the maintaining causes. So that what is gives more important before giving a similimum. Because if the maintaining cause is there and if you're not removing it, by giving a gallons of medicines also of no use there. And third is talks about the treatment history. Whether the treatment has modified the original disease or not modified. If the modified, we have to find out a original disease. Then last only talks about if these three causes are found out properly, sit with the patient, get the totality and give a medicine. That is what protocol he has given for the treatment, where sir has highly mentioned that the maintaining factors which is required for the treatment, specifically the nutrition deficiencies. So unless you remove the nutritional deficiency, you cannot treat. So this is a well-deserved presentation, sir. Congratulations and wishing you all the best. And second speaker was Dr. Ritesh Ratnakar said, young. The way he was presented is a simple and humble way. And at the end, he has acknowledged few people where he has learned. That is what is has a desire to learn further. And he has presented a simple case, even though it is complicated, where integrative systems can give a better quality life to the patient. We know that it is a difficult case, primarily may not be, there is a scope for homeopathy, but after chemotherapy and radiotherapy, along with the homeopathic system, how we can make a quality life. Because these patients requires a quality life, not a quantity life. That is what Sir has, Dr. Ritesh Ratnakar said has given, and you have a bright future, Ratnakars. All the best for you. And Dr. Mini Ivy, I have seen many national and international conferences. She presents a very good, innovative, I'm saying again, the innovative research papers. And today's research papers, people may be wondering, the fruit fly, which is very, very small, even for the naked eyes, difficult to see. Only we can see the group of, this fruit fly sit together, we can notify that. Among them, finding out a diabetic activity. First you make them diabetic, then you treat with abroma. That is really good scientific study, and such scientific studies are really required. And this type of studies with the research protocols, he has followed all the protocols which is required for the research. So this research will definitely take homeopathy into a more scientific world. So Dr. Mini, let's continue this good work and be presentable with the real innovative research work. So wish you all the best. So with this, already sounds are coming to my left side in the ground with the big bangs, and this I could hear when I was sitting there. I think the fiesta is waiting for you all. Today you had a good fiesta at homeopathic way, and in the evening, hope you'll be enjoying the fiesta and the hospitality of Father Muller's Homeopathy Medical College. And it is for me a back to home that I was there for almost 22 years in Father Muller's, plus 5.5 years of my UG, this thing. So this is a homecoming for me. So I enjoy all the moments coming back to Father Muller's. Thank for the opportunity, and thank you everyone. Thank you.
Thank you, sir. May I now request Dr. Roshan Pinto, sir, to kindly present certificates to the speakers as a token of appreciation. Dr. P. Suresh Kumar. Dr. Ritesh Ratnakar Sheth. Dr. Minnie Ivy. May I invite Dr. Girish Navada UK, Medical Superintendent, Professor and HOD, Department of Psychiatry, Father Muller Homeopathic Medical College, to present the token of gratitude to our moderator for the session, Dr. Roshan Pinto. Thank you, sir. With this, we conclude the open forum for the day. With that, we officially conclude day 1 of EXPLORA, the International Homoeopathic Conference. It has been a day filled with insightful presentations, inspiring discussions, and meaningful scientific exchange. Each session has added value to our understanding, reminding us of the depth and potential of homeopathy in clinical practice and research. We extend our sincere gratitude to all our speakers, judges and resource persons, delegates, faculty members, students for making today's events enriching and successful. As we bring the day to close, we look forward with excitement to day 2, where we continue our academic journey with more presentations, interactive sessions, and knowledge sharing platforms. Thank you once again for your active participation today. Wishing you all a pleasant evening.